Mm.
Yeah. Okay. Thank you for your patience. Yes, so there has to be a system where they will move from house to house, assessing or examining what people are to see if there are some toxic elements in the house that should be removed, especially when it comes to chemicals and that people cannot see with their eyes. There has to be a standard. Yeah, there has to be a standard. And well, of course, individuals may not have the technical know-how, so government should have a structure like that with experts doing this. And there has to be community assessment, provide information on health quality at the community level. Yes, I think this will help, especially those of you who are entrepreneurs, who double as entrepreneurs, because a lot of times people will want to rent based on a certain information, but you only realize that some of these agents guys will just come and then put their thing online, very nice picture, only for you to get there to see something disastrous and for you to move in to see something else. So maybe as with your background, you can set something up and go beyond that to provide the information on, let's say, maybe the building material, the average room temperature, and all those things. For people to make very informed decisions about the room they are going to rent. Yes, so maybe you have it, but you conceal some of the information until they have paid before you release all the information about the building. And by that, you can be making money from that. And so there has to be standards, and there has to be structures so that it's not just because one needs one needs a place to rent. So any baby akeke, it's not just anywhere that the person should be allowed to rent. And it's not every room that or house that we should allow landlords to give out on rent, because clearly some of the buildings are death traps. You look at it and you would wonder, but these people will still go ahead, all in the name of because the place is easily gone, or because the place is in a very vantageous or it's a popular area. So they'll just create a small room and then do some small cubicles and call it 2 bedroom. Yeah, you know, there has to be standards. So services for homeless people. Yeah, so public health agents should frequently offer clinical assessment and management services to homeless shelter clients. Yes, so like some of the children you wonder. So if they should sleep on the floor and they develop pneumonia or some other condition, you wonder where they go to for care. So sometimes, and you find that they don't have the courage to go to the health facilities, the clinics, the hospitals. Sometimes we should make it an effort to go to them, meet them, and then help them out, because they don't have the confidence to come. So once in a while, you can just move to the field and then go and screen them, and then yes, I think it's one of the ways that if God will be happy about it, will advance. You know. So, in as much as you are thinking about going to the consulting rooms, working, and you should also consider that there are some people who do not have place to put their head, and they may at increased risk of all forms of things that a decent building would have protected them against. So we have advocacy. Community health workers should take the lead in advocating for housing policies that ensure access to affordable, healthy housing and elimination of remediation of unhealthy housing stock. So yes, we have the rent control, and even the rent control, they are incapacitated. They don't have adequate resources to even implement the available policies. But it is just good that we also make sure that there are standards for housing units that are given out. And if maybe things are going wrong, then you should tell your if you're in asbestos and now you realize that asbestos is not helpful to your health, you can encourage your landlord to come and fit it with some ceiling or even change it for you if the resources are there. So there has to be standards. There has to be standards. So WHO has some guidelines that I will quickly go through. So it says aims at informing housing policies and regulating national health, emphasizes the importance of collaboration with health and other sectors and joint efforts across levels to promote healthy housing. Yes. So it just talks about this is just a description of what the WHO housing and health guidelines stand for. So it's going to influence what we do even at the national level. So basically, when WHO has something, the government takes it and then breaks it down to the district level, and they try to localize things. So, and you also one thing we mentioned last semester is that whether public health or community health, it needs collaborative efforts. You cannot just get up and just do everything, but you need other structures in the system because we are social beings to support what you are doing in order to work. So it has to be a collaboration between the health, like the health sector, and then let's say Ministry of Health, and you also have the ministry in charge of housing to also come in, and maybe social welfare because they also help homeless children. And we also need the finance because in the finance ministry, if there's the need for money, they know how to get the money. So at the end, you realize that we need all the, even including roads, because we need very good routes. So you realize that we need all the arms, all the branches, or the departments of, or most of them to be able to achieve our desired health outcomes. So the guideline implementation account will be in particular contribute to the achievement of Sustainable Development Goal 3 and 60. Okay, well, the guideline bring together the most recent evidence based on newly commissioned systematic reviews, reducing health burden due to, so the WHO, um, the SDG, the SDG, most of the goals in the SDG aim at reducing or improving health conditions and taking HIV and TB, for instance, they want to end TB by 2030. So yes, they want to reduce the health burden due to unsafe and substandard housing. So as policymaker, then you should, this is the WHO's objective. So as a local director, you ask yourself, so in my locality, what can I do to reduce the health burden due to unsafe and substandard housing? Documentation relevant to inadequate living space or low and high income temperature. Yes, all those things should be documented. In addition, the guideline identifies a summary existing recommendation related to housing with respect to water, air quality, neighborhood noise, asbestos, lead, tobacco smoke, and radon. Yes. So these are things, they have to be standards. Even neighborhood noise can even affect you in your home, especially if you are living between two churches or two mosques. You know, early in the morning around 4 a.m. Maybe you are not a Muslim, so you won't wake up to pray. A friend who is now in Belgium usually helps people. He works till around 3 o'clock, and by 4 o'clock, it looks like he has some Muslim neighbors who have private mosques in their homes, and they have the megaphone. And there's not far, there's another, a larger one. So it means that once it is time for prayers, and then they start calling people for prayers like Allah Akbar, he has to wake up. So most often he enjoys about 31 hours sleep, and during the day, then yes, but he would wish he could sleep throughout the night. But So, and it's not just Muslims, but Christians. There are some services that I feel we can. And one thing I don't understand is in the building to hear what the one presenter or the preacher man is saying. But it looks like people want to open the volumes to a point where people all over in the area will hear what is happening inside. And we are all in the container. At the end, in the long run, once the decibels goes up, it's going to affect the hearing abilities of those who are immediately in the room. And one thing I think some of those churches have not realized is that even when you are preaching, I'm not sure that there's someone will be doing something outside and it will be hearing you clearly. Maybe the person is watching television or is doing something, is not giving attention. And once again, if we really want to get them to hear the message, then I think maybe after church we can move out of the church and go and share with them what we have learned. But if you are in the church and you raise the volumes thinking that those out there are hearing, I just think you are only doing harming ourselves. So, and there has to be, there are standards, but just that Ghana here, we don't work with it. I think apart from Kumasi, where some churches were sent to court for making noise beyond the required level. And also asbestos, you have the lead, sometimes in the water bodies, sometimes, and tobacco smoke. Some people, they are just habitual chain smokers and they don't mind whether people are around them. My kid sister used to work somewhere with a Lebanese boss, and this man can just come to your office and be smoking like that. And on occasion, she will tell him to stop, but he kept on because he thinks he owned the business. And so that and other conditions made my sister resign from the workplace. It's just not fair. Just not fair. So yes, yes. If you want to read more about the policies or to know more about housing and health, here are some articles for your reading. For your reading. So, so what you should know about this in preparation for exams is you have to see. You should be able to. Um, how do I even call it? You should be able to identify things that in our living space that can make us fall sick or can improve our health and the way forward. And another thing, you should also be able to, assuming you are the director or district health director and you know how housing can affect health. So what can you do as a director, district health director, to improve housing in your districts? And in that case, you can borrow some ideas from here, interventions for improving health. Okay. So thank you very much for your time. Any question?
Any question?
Hello? Any question?
Yeah.
Yes. Or comments?
Anybody has any question or comment? Mhm.
Yes, sir. So
Yes.
please, about our assessment, how are you
Okay.
going to go about it? Because we've not got any assignment.
Yeah,
Yeah.
I think I gave you an assignment last week, or an assignment that
Yes.
the regular students are doing. Yes, so I think that would be 30. And And it is the exams that I have not decided with Dr. Ansan yet. Laurentia is also busy. She's trying to finish her PhD work. Yes. I'm listening.
Oh, yeah, continue.
Oh, okay. So I think I'm done for the day.
Okay.
Yes. So thank you all for coming.
All right.
So God
Thank you
willing,
so
next
much
week.
for your
Yes.
time.
Thank you, sir.
And
God bless you too.
Nick,
Yes, sir.
welcome. The Google Classroom, I uploaded the PowerPoint there, but I am not able to retrieve the code that I can send to the class to join.
Okay.
Yeah.
Offline, I'll take you through. Don't worry.
Okay. No.
It's very simple.
Okay. So it means that you'll soon be joined to the Google Classroom for your lecture materials and other
All right, sir.
discussions.
All right, sir.
Okay. Thank
All
you.
right, sir.
Stay blessed.
Thank you. You too. Amen.
Thank you. Bye.
Bye.